Still think all fruit is good for you? Well, what if I told you that some fruits, if eaten the wrong way, at the wrong time, could actually spike your stroke risk overnight? We've all heard the saying, an apple a day keeps the doctor away. But after more than 30 years of being a doctor, I can tell you this. The wrong fruit, at the wrong time, might have the doctor calling 911. Fruit is nature's candy. It's sweet, colorful, full of antioxidants. But behind that shiny skin, some fruits can cause sudden blood sugar spikes, mess with your electrolytes, trigger silent inflammation in your blood vessels, and even interact dangerously with your medications. And the scariest part? You won't feel a thing until it's too late. According to the American Heart Association, 3 out of 4 strokes happen in people over 65. No warning, no pain. Just one morning, you wake up and your arm won't move. So what's silently damaging your blood vessels every single day? In this video, I'm a 60-year-old doctor trained at Harvard, and I'll walk you through the common healthy fruits that might actually be working against your brain and heart. By the end of this video, you'll know which fruits to avoid, limit, or eat the right way, how to protect your heart and memory with just a few small changes, and most importantly, how to live longer and stay sharp without giving up the foods you love. If you're in your 50s, 60s, or caring for aging parents, this video is your compass to help you navigate the fruit maze safely. Don't forget to hit subscribe and turn on the bell, because every week, we bring you easy-to-understand, science-backed videos to help you stay healthy and strong as you age. I've been a doctor for over 30 years, and if there's one thing I've learned, it's this. Sometimes, the things we think are healthy can turn dangerous when taken out of context. Today, I want to talk to you about a fruit that almost everyone loves, especially on hot, sunny days: pineapple. I know, it sounds strange, right? Pineapple, with its sweet taste, fresh smell, and cool, tropical vibe, feels like a gift from nature. But I want you to picture this. One morning, I got a call from George, one of my 67-year-old patients. He sounded tired. His stomach was upset. His blood pressure was all over the place. He said, "Doc, all I had was half a pineapple this morning. I'm just trying to eat healthy." And that is why I need to speak up today. See, pineapple, while it is a natural fruit, is also high in acids and simple sugars. If you eat it on an empty stomach, especially after age 50, your digestive system, which naturally gets more sensitive with age, may react with low-grade inflammation, bloating, discomfort, or even sudden swings in your blood pressure. And here's what most people miss. The natural sugars in pineapple can cause a fast insulin spike, especially if you eat too much of it, or eat it alone, without any protein or fiber to slow down that sugar hit. Now you might be wondering, so, should I stop eating pineapple altogether? No, not at all. I'm not here to make you afraid of food. I want you to understand your body better, to eat smarter, not stricter. So here's my tip, the same one I gave George that day. If you want to enjoy pineapple, keep it to about half a cup at a time. And don't eat it on an empty stomach. Pair it with a little Greek yogurt, or a few leafy greens. Just that small change can make a huge difference. Have you ever felt discomfort after eating pineapple? Your body is always sending you signals. We just get so used to ignoring them. Today, I hope you'll start tuning in a little more. Not out of fear, but to live more consciously and more in control. And if you found this message helpful, please share it with someone you care about. Who knows? You might just help them avoid a silent stroke. I want you to picture a typical morning. You wake up, brew some tea, and grab a banana on your way out. You're thinking, bananas are healthy, full of potassium, good for the heart. Sounds reasonable, right? I used to think the same, until I started seeing a pattern among my older patients. There's this lovely couple, Henry and Lucy, both in their 60s, very health conscious. Every morning, a banana. Lunch, fresh squeezed orange juice. Dinner, avocado on salad. Honestly, almost too healthy. And yet, both of them came into my office with the same complaints. Heart palpitations, a jittery feeling, and occasional dizziness. The cause? Not illness, but too much potassium combined with their medications. You see, bananas are sweet little potassium bombs. A single medium banana packs over 400 milligrams of potassium. Now, that might not sound like a lot, but if you're taking diuretics or blood pressure meds like ACE inhibitors, lisinopril, enalapril, etc., your body can't flush out potassium like it used to. What happens next? Your blood potassium levels creep up silently, and one fine morning, your heart starts skipping beats, literally. Now, don't get me wrong. I'm not saying bananas are bad. I still eat them myself. But if you're over 50 and on meds, bananas aren't as harmless as they used to be in your 30s. The solution? Super simple. Stick to half a banana at a time. And try not to combine it with other potassium-rich foods like oranges or avocados in the same meal. I remember asking Henry after his heart checkup, "When was the last time you had a banana?" He grinned and said, "This morning, document." I wasn't going to tell you. We don't have to avoid fruit. We just need to adjust based on our age and our current health. Because sometimes the difference between healthy and risky is just half a banana. I once had a patient, Mrs. Helen, 72 years old, an absolute strawberry lover. Every time she came to my clinic, she'd bring a small jar of fresh strawberries, and she'd say with a smile, "Doctor, I eat strawberries every day to keep my skin young, just like in my 20s. And honestly, she wasn't wrong. Strawberries are full of antioxidants, low in calories, and naturally sweet, making them a seemingly perfect snack, at least in theory. But during a routine checkup, her blood pressure was unusually high, and there were some early signs of hormonal imbalance. She thought it was just aging, but I started suspecting something much smaller: the strawberries themselves. You see, strawberries, as beautiful and delicate as they are one of the most pesticide-contaminated fruits in the U.S. Every year, the Environmental Working Group, EWG, includes them in the Dirty Dozen list, the top 12 fruits and vegetables with the highest pesticide residues. And for people over 50, the body isn't as efficient at filtering out toxins. Even small amounts of those chemicals can slowly disrupt hormones, blood pressure, and kidney function over time. So I asked Helen, "Do you wash your strawberries before eating them?" She smiled and said, "Of course, just with cold water." That's when I taught her to soak them in salt water or vinegar water. Better yet, I suggested switching to organic strawberries whenever possible. Just a few weeks later, her blood pressure stabilized, and she told me, "Now I don't just eat them for pretty skin, doctor. I eat them because I actually understand what my body needs." Have you ever thought that a tiny little strawberry could be quietly messing with your system? I know it sounds unbelievable, but here's something I always remind my patients. The more natural something seems, the easier it is to let our guard down. And once you're over 60, there's no room for being careless anymore. I still remember one hot summer afternoon last year. Mr. Frank, 68, walked into my office. His face was flushed, his heart racing, hands trembling. He looked at me and said, "Doc, all I had was a bowl of watermelon. Why do I feel like I'm about to faint?" I asked him how much he had. He said, "A big bowl, probably half a watermelon." And that was the problem. Watermelon, sweet, juicy, refreshing, seems like the perfect summer treat, especially for older adults. But for many of my patients over 50, particularly those dealing with insulin resistance or prediabetes, watermelon can be a double-edged sword. You see, watermelon has a very high glycemic index, GI, meaning it spikes your blood sugar rapidly after eating. And that's not all. It's also rich in potassium, which can throw off your electrolyte balance, especially if eaten on an empty stomach or after sweating heavily. In Mr. Frank's case, he just finished mowing his lawn in the heat. He lost fluids and electrolytes through sweat. Then he ate a massive portion of watermelon, causing his blood sugar to surge. The result? A dizzy spell that nearly sent him to the ground. Now, I'm not saying you can't eat watermelon. I eat it too. But I always tell my patients, stick to a small cup, about 150 grams is enough. And if you can, pair it with some mint leaves or a few almonds to slow down the absorption of sugar into your bloodstream. Just imagine this. You're enjoying a cold slice of watermelon on a sunny afternoon. Sounds perfect. But inside your body, your pancreas is going into overdrive. Insulin spikes, then crashes, leaving you feeling exhausted without knowing why. Sounds dramatic, right? But that's the reality for hundreds of my patients every year. Every spoonful of fruit, when eaten right, can be healing. But if eaten wrong, it can act like a silent stimulant. One morning, I was sitting with Mary, 64 years old, during her routine checkup. She's one of my most disciplined patients. Eats clean, exercises daily, and always walks into my office with a bottle of fruit smoothie in hand. She smiled proudly and said, "Doc, I've quit coffee. Now I just drink smoothies from Whole Foods. Great for my heart and skin." I smiled back, but in my head, alarm bells were already ringing. I picked up her smoothie bottle to check the label. And sure enough, 60 grams of sugar in just one bottle. Yes, you heard that right. That's 15 teaspoons of sugar. You see, bottled smoothies are often sweet traps in disguise. They contain very little fiber. Most of it's been filtered out, but are packed with sugar from bananas, mangoes, grapes, or concentrated fruit juices. And when sugar enters your body without fiber, it causes insulin spikes and blood sugar swings, a major trigger for high blood pressure, metabolic issues, and yes, even stroke in adults over 50. I asked Mary, "Do you feel sluggish around noon? Maybe a bit dizzy?" She paused, then nodded slowly. Yes, I thought it was just age. But no, her body was running on empty, drained by what she thought was healthy sugar. So I shared with her my go-to smoothie recipe, the one I give all my patients. 50% leafy greens, like spinach or kale. 50% low-sugar fruits, like green apple, avocado, or blueberries. Add chia seeds or flax seeds for fiber and omega-3s. The result? 3 weeks later, her blood pressure stabilized, her afternoon energy lasted longer, and she smiled at me and said, "Now I don't drink smoothies just because they're healthy. I drink them because I finally understand what my body actually needs." Let me ask you this. Are you drinking something you think is healthy, but is slowly damaging your body? Read the label. Make it yourself, if you can. And always remember, not everything labeled healthy is truly healthy. I still remember Mr. Jerome, a kind 72-year-old man who always carried a bag of grapes in his car. He said to me, "They're tiny, document, and grapes are good for the heart, right?" I asked him, "How many do you eat at a time?" He chuckled, "Maybe a whole bunch." And that's exactly where the problem lies. Grapes, small, sweet, and easy to snack on, are actually one of the highest fructose fruits out there. Now, fructose sounds harmless, but when your liver gets too much of it, it can turn into visceral fat, the dangerous kind that wraps around your organs, leading to artery hardening, poor lipid profiles, and an increased risk of silent strokes in older adults. And there's more. Grapes also contain a decent amount of vitamin K, which can interfere with blood thinners like warfarin. For patients on anticoagulants, eating too many grapes can mess with INR levels, raising the risk of either excessive bleeding or dangerous blood clots. So I told Mr. Jerome, stick to just 5 to 6 grapes per serving. And even better, pair them with some protein or healthy fats, like a small piece of low-fat cheese or a few walnuts, to slow down the sugar absorption. Now, be honest with me. Have you ever sat down to watch TV and mindlessly munched on grapes? Totally understandable. They're sweet, pop right into your mouth, no peeling, no fuss. But that very convenience is the hidden trap for folks over 50. You don't need to cut grapes out of your life. You just need to understand them and respect your limits. Because just like people, tiny doesn't always mean harmless. And grapes, oh, they may be small, but if you're not careful, they can stir up some real trouble. I remember one time Lisa, 58 years old and pre-diabetic, came into my office with a troubled look. She said, "I've quit soda, I eat clean, I drink water regularly, and I only eat 1 mango a day." I paused for a moment and asked, "Do you know how much sugar is in 1 mango?" She shook her head. "Over 45 grams. That's nearly 11 teaspoons of sugar, in just one fruit that most people think of as healthy." You see, mangoes are naturally sweet, refreshing, and delicious. But for people with insulin resistance, prediabetes, or those already managing type 2 diabetes. A mango can be a sugar flood, silently entering the bloodstream, causing inflammation in blood vessels, damaging artery walls, and increasing the risk of blood clots, a key factor in silent strokes. I told Lisa about a former patient of mine. He didn't eat candy, didn't touch refined sugar, but loved tropical fruits. After a few months, his HbA1c spiked, even though he looked perfectly healthy on the outside. Now, I'm not saying you need to quit mangoes completely. I just want you to eat them smarter. Try pairing mango with fiber-rich greens like cucumber, spinach, or kale. And if you really want to eat a whole mango, split it in half. Eat one part now, the other a few hours later. That way, your body isn't slammed with a sugar load all at once. Have you ever thought, mango is just fruit, how can it be bad? I get it. A lot of people think that way. But the real question isn't about what's good or bad. It's about what's right for your body at this stage of your life. I once asked a 63-year-old patient, "Do you drink orange juice every morning?" He smiled. "Of course. A glass of fresh OJ. It's good for the heart, right, Doc?" I nodded, then gently followed up. "Do you squeeze it yourself, or buy it pre-made?" He said, "Usually the bottled kind from a store. It's just easier." And right then I knew. He wasn't drinking orange juice. He was drinking liquid sugar disguised as oranges. Even a glass of freshly squeezed orange juice contains over 20 grams of sugar, because it takes 3 to 4 oranges to make just one glass. When you remove the pulp, you lose all the natural fiber. What's left is mostly water and fructose. And when you drink that on an empty stomach, your blood sugar spikes, your blood pressure rises, and in some cases, blood vessels can even dilate abnormally. I remember during an ER shift, a patient came in with a dangerously high blood pressure episode, triggered by nothing more than his healthy habit of drinking orange juice in the morning. He had no idea his heart was under that much strain from what he thought was just juice. So here's what I recommend. If you love oranges, eat the whole fruit, and keep the white pith. That's where the pectin lives, a fiber that helps slow down sugar absorption. If you still want orange juice, dilute it with water, 1-to-1 ratio. You'll still get the orange flavor, but with half the sugar hit. Do you drink orange juice daily? You may think it's vitamin C. You may think it's heart healthy. But have you ever checked your blood sugar? After just one glass? Too much of anything, even the good stuff, can turn into a burden. And after 50, your heart doesn't bounce back from sugar shocks like it did in your 30s. I once had a patient, Margaret, 67, who proudly told me she'd given up cakes and soda. But in her purse, there was always a bag of raisins. I replaced snacks with dried fruit. That's better, right, doctor? She asked, hopeful eyes locked on mine. I let out a soft sigh. Then I pulled out my phone and showed her a picture. Do you know that just 1 cup of raisins contains over 100 grams of sugar? That's almost 25 teaspoons of sugar. Her eyes widened. Oh my, I thought fruit couldn't hurt. And that's the trap of dried fruit. It's small, portable, sweet, but the sugar is condensed, often 4 to 5 times higher than in fresh fruit. You can easily eat a handful without realizing you just took in over 300 calories and dozens of grams of sugar. No water, no natural fiber. The sugar rushes into your bloodstream, fast and sharp like a blade. For older adults, especially those with vascular inflammation, high blood pressure, or diabetes, this isn't a snack. It's a spark that can trigger internal inflammation storms. So here's what I always recommend. Stick to just 1 to 2 tablespoons at a time. Never bring the whole bag. More importantly, pair it with protein. Some walnuts, a slice of fresh cheese, or a bit of Greek yogurt. This helps slow down sugar absorption, preventing that dizzy, drained feeling an hour later. Have you ever chewed through a handful of dried fruit while watching TV, only to realize half the bag is gone? I get it. I really do. But just remember, dried fruit is not a healthy snack if you eat it like regular snack food. I remember one afternoon, a woman in her 60s came to my clinic, holding a bag of bright red apples. She smiled and said, "Doctor, I've switched from candy to apples. That's better, right?" I glanced at the bag. Perfectly sliced apples, peeled and packed like a healthy snack. I smiled back, but deep down, I had a big question mark. Apples are a great fruit, but only when you eat them the right way. She had unknowingly thrown away the most valuable part, the skin. Did you know that nearly 70% of the fiber and antioxidants in apples are found in the peel? By peeling it off, you're left with the sweetness, but you remove the natural filter that slows down sugar absorption. Let me paint a picture for you. A peeled apple slice is like white bread. The sugar hits your bloodstream fast, but a whole apple with the peel, paired with a little healthy fat, like peanut butter, acts like a cushion, softening the blow for your pancreas and blood vessels. I had a patient with prediabetes who ate a few apple slices every morning. She thought it was a healthy habit, but her blood sugar kept spiking like a roller coaster. After I suggested keeping the peel and adding a spoonful of peanut butter, her levels stabilized within weeks. The problem isn't the apple, it's how we eat it. If you're confident your apples are clean, don't peel them. Eat the whole fruit, just as nature intended. And don't forget, add a little protein or healthy fat, like almond butter, a few nuts, or a slice of cheese, to slow sugar absorption. Are you peeling apples every morning for yourself or your loved ones? If so, maybe it's time to take a second look, because sometimes it's the smallest choices that make the biggest difference in our daily health. You don't have to cut fruit out of your diet completely, but if you're over 50, with a history of high blood pressure, diabetes, or heart issues, eating the wrong fruit the wrong way can actually be a serious risk. What you really need isn't fear, it's to eat the right fruit the right way at the right time. Always pair fruit with protein, healthy fats, or fiber to slow down sugar absorption. Avoid eating fruit on an empty stomach or right before bed. Prioritize fresh, organic fruit and limit juicing or dried fruit. But most importantly, listen to your body. Don't ignore even the smallest warning signs. A stroke can come without any heads up at all. Get regular checkups. Stay proactive. Prevention beats cure every time. Call to action. If this video helped you see the hidden risks behind so-called healthy fruits, smash that like button. Share it with your parents or anyone over 50 you care about. And hit subscribe so you never miss a video packed with real senior health wisdom. Because knowledge isn't just info, it's your ticket to living longer, living stronger.